Hello, it's Dr. Rhonda Johnson, and today is Tuesday, December 8th, 2020. Well, overwhelmed and to the breaking point. That's what many healthcare systems in the United States are reporting today. You know, COVID-19 is spreading dangerously everywhere in the United States. And as bad as things are, experts are saying that it's only going to get much worse. You know, hospital staffs are strained, nurses, doctors, frontline healthcare workers are overwhelmed. ICU beds are at capacity. And we've had over 1.5 million new cases in the past 5 days. And the COVID cases who become COVID patients just keep coming. I was on a phone call with healthcare leaders recently, and some of them said that soon in their hospitals, decisions are going to be made. Who will get admitted? Who's going to get sent home? Who's going to get an ICU bed? Who will get a ventilator? And folks, these decisions are going to be made by doctors and nurses who are exhausted. So now is not the time that you want to be getting sick and having to go into the hospital. So I ask this question: what are you doing to stop COVID-19? Are you still eating at restaurants indoors? Are you still going to the gym, folks? Are you still worshiping at church in person? Are you going shopping at the malls? Are you attending parties and dinners at people's homes that are outside your immediate family? Are you hanging out with your friends and taking off your masks? Well, I certainly hope not. But again, I want to reemphasize these are very high-risk behaviors and almost guarantee you to increase your risk of getting COVID-19. Folks, in Pennsylvania, 58% of the folks who recently tested positive for the virus are under the age of 50, with the majority being between the ages of 25 and 49. So what are we up against? Well, we're up against the weather, for one. You know, the virus will survive longer in cold, dry air and low humidity. And low humidity also increases evaporation of those respiratory viral droplets, those larger particles that come out when we talk and sing or sneeze or cough, into these smaller aerosol particles because the moisture dries up. And these aerosol particles can linger longer in the air, becoming airborne. And once, it comes airborne and you're in this infected air, swapping air, that increases your risk of getting infected. Folks, the more viruses that are in the air, if you get infected, you will be exposed to a higher viral load. And with colder weather, we're going to be spending more time indoors in closer contact, significantly increasing the risk of transmission and infection of this virus. You know, I read a paper, I'm switching gears a little bit, a paper that was published November 25th in one of the clinical journals. It said that researchers at the CDC have said that the actual number of coronavirus infections could be approaching 100 million people now because folks aren't getting tested. So their model suggests that the true number of infections is about 8 times the reported number. So, the number that's reported is around 15 million. And that's just confirmed by the laboratory tests. So folks, with the CDC saying the number of actual infections is 8 times of what's reported, this puts this whole coronavirus pandemic in the United States into a whole new reality. I applaud everyone who's making the tough decisions right now to stay alive, because I know you may be subject to ridicule. People may ridicule you for making your life-saving decisions, such as wearing a mask, socially distancing, practicing good hygiene, and restricting your social activities. But I hope that you will continue to use every tool in your toolbox to stay alive, both today and in the dangerous weeks ahead. This is Dr. Rhonda Johnson. My views are my own. Stay safe and stay alive and have a blessed day.